We see both a difference in disease responses depending on what, sort of flavor maybe of psoriasis that is going on.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
What's up, everyone? All you Learn Skin listeners out there. Today it's going to be me flying solo, Dr. Raja Sivamani. I don't have Hadar with me, but he's always with me in spirit, right? So for his sake, I'm going to say, what's up, Raja? Well, we're going to be talking about some really cool things in the area of psoriasis and looking at the immune system and TYK2. So let me start by saying this podcast is brought to you by Bristol Myers Squibb. And we're going to be exploring a relevant kinase in the immune system known as TYK2. I think a lot of you have heard about TYK2. And we want to really explore what it means in immune-mediated diseases like psoriasis. And if we really think about the landscape of psoriasis and how we've started to learn about this disease, we have continually got so many new different research avenues that keep emerging. And because of that, we're learning more about the pathophysiology. But to do this, as we always do, we've got an expert that's joining us. And today we're pretty lucky. We have Dr. Chrissy Cornejo, and she's joining us from BMS. She is a dermatologist, and she currently works at BMS as the Director of Dermatology Medical Engagement Lead. And she's attended Penn State for undergrad, and she got her medical degree from UPenn. And she's practiced at Dana-Farber Cancer Institute and Brigham and Women's Hospital. And she was also an instructor at Harvard Medical School. So I'd say you know a thing or two about this, Chrissy. So we're super excited to have you join us.
Oh, thank you so much, Raja. I'm really happy to be here and appreciate you having me on your podcast. Super excited.
Yeah, and as always, we like to get to know who's joining us on the podcast a little bit more than what the resume tells us. And you've got some really interesting experiences along the way. As I know, you've recently transitioned from academic medicine to industry. So it'd be really nice to learn about your journey and maybe tell us what got you interested in dermatology in the first place. And then it's really interesting to see how you made that transition from clinical to industry. So if you don't mind us taking us through that journey.
Sure. Yeah. So it's a great question. Honestly, so I wasn't one of those people who, growing up, wanted to be a doctor or wanted to be a dermatologist. Something I sort of figured out along the way. I was always really interested in science, studied biomedical engineering in undergrad.
Oh my gosh, I got to come in and say, I love you even more now. I was a biomedical engineer too. Sorry.
Nice. Love it. Love it. And so, I graduated and I really loved going to school. I just wanted to keep learning. And I thought about different ways to do that. And I also knew I did like helping people. So I thought medical school might be a great avenue for me. Really loved med school. Wasn't, again, thinking about dermatology until kind of the last year. So I was initially focused more in oncology. And so was going the radiation oncology route until during my radiation oncology rotation in med school, they actually asked me to spend some time in dermatology to learn more about cutaneous lymphoma and they were going to start a total skin electron beam therapy program for that. But, the radiation oncologists weren't familiar with the disease state. It was something new to them. And they sent me upstairs to go learn from Alan Rook and Ellen Kim. And after a few weeks of that, I was hooked. And so I really liked, being able to use my eyes and kind of be a detective, figuring out what's going on with someone primarily by looking at their skin. And so they weren't super thrilled, though, in Red Onc when I switched over.
I can imagine.
Yeah. I practiced for about 5 years, did mostly high-risk skin cancer as well as, melanoma up at Dana-Farber. And then, made that switch over to industry in January of this past year. So it's been about 8 months or so that I was on the team here. And so kind of what led me to that switchover, I think there's a few different things, but honestly, the moment where I made the decision was I'm filling out this sheet that we have to do each year that, goes over just, what's your ongoing research, what publications have you had in the last year, and your short and your long-term goals. And for the last few years, I was really just forwarding the answers, the same goals I had originally listed. So, publish more, get promoted, etc. But, this past year, I really started to think about where I saw myself in, 3, 5, 10 years. And I honestly didn't know. From the time I started residency, I just had this expectation that I would, join an academic hospital. And I never really considered other practice settings or anything outside of clinical medicine. So I felt like I was at this crossroads where I could either keep going down, this path of academic medicine, which would have been fine because I love what I was doing, or I could take this opportunity to just see what else was out there. And so, industry in particular, it always felt like this big unknown. And I think that's what ultimately drew me to it. So my curiosity and the excitement of a new challenge. And in particular with, the role I have now, what excited me was the opportunity to conduct critical activities that support advancing science, educating on evolving clinical practices, transforming that science into patient care, and then facilitating the development of new research. And so it's helped open my eyes to the various ways you can be involved in advancing science and helping patients beyond direct clinical care, and engaging in meaningful peer-to-peer scientific dialogue with national thought leaders and other healthcare providers, has been a great bridge to my clinical experience and industry where I am now.
Chrissy, I have to say, first of all, thank you for sharing that. I think this is a common theme that I've heard is when people go to residency, you're kind of shown the academic environment and you don't realize that there are quite a lot of other pathways that you can take with a dermatology board certification or dermatology training. Did you have any mentors that had actually gone into industry, or did you have any inspirational moments from other people that had done this before, or was this something you just took as a leap on your own?
No, it was just a leap on my own. I really didn't know, much about industry in general, until I interviewed and met the great team here. But again, I think that's kind of what drew me to it was sort of the not knowing. And I feel like, each step of the way through training, med school, residency, practice, that what will it be like has always been really exciting to me. But, I think that's one of the comments I've had from just some of my colleagues when I left and just some of my friends who have sort of thought about, transitioning to industry, but that sort of, not sure if they could do it, the fear of the unknown. And so for some people, I think that can be a deterrent. For some people, that's, something that draws them in. And I think that's one thing that I really want to be able to do now is sort of mentor people in that, they're still in that clinical space, but thinking about, other career opportunities, because I think it is, a big jump. There's a big learning curve. And fortunately, the team has been really great at, kind of helping me adapt to that.
Well, be careful what you wish for. You might get hundreds and thousands of emails now and contacts, but regardless.
Bring it in. Yeah, I'm looking forward to it.
Yeah, right. Oh, exactly. And I think that it's nice to just hear your experience on this, because to everyone listening, there are other pathways out there that maybe if you haven't considered, you have an itch in the back of your mind, think about it and talk to people. So really appreciate you sharing how you kind of shifted over the course of your career and, how now you've moved into the position that you're at. Now, to get to the meat of what we're doing today, we are talking about TYK2 and its role in the inflammatory cascade. And probably a lot of people aren't totally familiar with what TYK2 is. So can you talk a little bit about it and how it works?
Sure. So TYK2 stands for tyrosine kinase 2, and it plays a key role in mediating signals from various cytokine receptors in the inflammatory cascade. And it's part of the Janus kinase or JAK family, which has a significant role in regulating immune responses and inflammation in our bodies. And so, to understand TYK2 and its role better, let's break it down a bit. So TYK2, with a partner JAK, it's involved in signaling pathways of several important cytokines that cause inflammation. So when these cytokines, circulating in our body bind to their respective receptors on the cell surface, TYK2 gets activated intracellularly and starts a cascade of reactions that help orchestrate the immune response. And so this pathway is implicated in certain immune-mediated diseases like psoriasis, psoriatic arthritis, lupus, inflammatory bowel disease, Sjogren's disease, multiple sclerosis, and others. And genetic studies have suggested, TYK2 gene variations may impact the risk of certain autoimmune diseases. And so, further research to better understand its role in these diseases is needed.
Well, thanks for giving us an overview of TYK2. Now, can you tell us what is the role of TYK2 specifically of that pathway in psoriasis?
Yeah, great question. So, we know psoriasis results from a complex interaction of, genetics, environmental triggers, and immune dysregulation, and is associated with increased activity of several cytokines, including TNF alpha, interleukin 22, interleukin 23, and interleukin 17. And so one of the inflammatory pathways in psoriasis is driven by type 1 interferons, so interferon alpha, interferon beta, which are produced by the dendritic cells during disease development. So the type 1 interferons activate dendritic cells via TYK2 mediated signaling to produce TNF alpha and interleukin 23, which drives plaque formation in psoriasis. And then interleukin 23, IL-23, can further drive the development of psoriasis plaques by activating Th17 cells, so a subset of our T cells, via TYK2 mediated signaling to produce IL-17. And so this IL-23, IL-17 pathway is really a key driver in psoriasis pathogenesis.
Yeah, thanks for giving us an overview there. And absolutely, we have these cytokine drivers. And I think one of the big conversation points that comes up is that TYK2 really is part of the, as you kind of gave a very nice overview of the JAK family. And we know that the members within the JAK family function differently. And probably a little known fact, I think to a lot of people, including myself, until I started really looking deep into this, was that TYK2 was discovered first, and that's why it has a different name, right? And so Can you talk a little bit about that? How is TYK2 different functionally from JAK1, JAK2, and JAK3, which are the other players in this JAK family?
Sure, yeah. So, TYK2 was the first member of the JAK family, or the Janus kinase family, to be identified. And, these, JAK family members, so there's, TYK2, JAK1, JAK2, and JAK3, they act in pairs to modulate signaling of various cytokines and growth factors. And so cytokines mediated by these various pairings can affect certain immune system responses as well as other functions in the body. And so, for example, pairs containing TYK2 and JAK1 or JAK2 mediate the signaling of cytokines such as the type 1 interferon, IL-23, and IL-12, while pairs containing two JAK2 family members mediate signaling from erythropoietin, growth hormone, thrombopoietin, and granulocyte monocyte colony stimulating factor. JAK1, JAK2 pairs mediate interferon gamma signaling. JAK1, JAK3 pairs mediate IL-4 signaling. So, they really have, different roles depending on the pair that's involved in the pathway. And so the TYK2 pathways, in particular, are specifically involved in immune functions such as immune cell differentiation, activation, and survival. TYK2 pathways are also involved in the production of pro-inflammatory cytokines, including IL-17, as we talked about, as well as antigen recognition and antibody production. But to date, TYK2 pathways haven't been shown to be involved in any broad metabolic or hematopoietic functions. And JAK1, 2, and 3 pathways, while they also regulate immune functions such as immune cell differentiation and survival, also mediate broad systemic effects, like hematopoiesis, myelopoiesis, lipid metabolism, and metabolic activity.
Well, I think it's really interesting to go over how TYK2 functions differently. And I come up with this almost kind of corny, maybe even borderline dorky kind of conversation piece, because it used to be on the social media platforms like Instagram, TikTok. People used to talk about thinking about the Roman Empire. What's your Roman Empire? And what's funny is I always wondered, like, Janus, where did that come from? I was like, was it a long lost love? No, it wasn't. It turned out it was named after the Roman god, Janus kinase, because I guess they dimerize and it's like a two-headed god. So Now it's like a funny little thing. Every time I think of TYK2 or, the JAK pathway, but TYK2, I also think of the Roman Empire. So I guess this has become my Roman Empire in some weird sort of way. So
I love it.
for whatever it's worth. And for all of you that have heard me say that corny joke before, too bad. I guess you heard it again. So
We
it is
love
what it
corny
is.
here, so.
All right, so we talked about function. So they do function differently, and I really appreciate you talking about the different pairings because I think that's key in the versatility of the JAK pathway, but also to not just make every single JAK component equivalent to each other, right? I mean, I think that's the point here. So TYK2 is structurally different from JAK1, 2, and 3. Can you talk about how they're different structurally? I know we talked about function, but how are they structurally different?
Yeah, great question. TYK2 and, as the JAK1, 2, and 3 kinases, so you mentioned, part of the same family, and each member of that family is comprised of two components. So you have the regulatory or pseudokinase domain and a second component, which is the active or catalytic domain. And so the active domains of all four kinases are highly conserved or similar across the family members, whereas the regulatory domains of TYK2 and JAK1, 2, 3 are unique, and so a little different across the family members there.
Yeah, and I guess, one of the questions I've always had is when you're looking at psoriasis, do we know, are there differences between the different sort of subsets of psoriasis that are out there? Is there a difference between classic plaque psoriasis, or if the scalp is involved, or if the hand is involved? Any insight into that?
Yeah, it's a great question. I think we're starting to understand that more because, we see both a difference in disease responses depending on what, sort of flavor maybe of psoriasis that is going on. Also, just amongst patients with even similar disease presentations may have different drivers. And so I think in the future where, as we get to sort of understand kind of more what's behind the disease on a kind of individual basis through kind of precision medicine, I think we'll have a better understanding of that. But I think it's still yet to be determined.
Well, no, I appreciate you taking us on a journey through TYK2. I do have some other questions, kind of going back to what we talked about in the beginning, because I think this is really, really interesting as you were a clinician before and you've kind of moved away from treating patients, right? Do you still see patients now, or is it?
I have taken a break while I, was adjusting to this new role, but
Right.
I am going to get back into it. So that's one of the fortunate things about this, position is that I can, keep seeing patients, which is definitely something that I miss and I want to get back to as soon as I can.
Yeah. How do you think your knowledge base as a dermatologist really helped in this position, just in terms of understanding pathophysiology, maybe understanding the patient experience? Like, what do you think was helpful about being a dermatologist in general and, making the transition from dermatology as a practicing clinician?
Yeah, I mean, I think having, I think dermatologists in general have just a ton of sort of, knowledge in immunology and some would say
Right.
we're also sort of immunologists and actually taught in the immunology course at Harvard Medical School. And so I think that definitely helped because, a lot of what I do now is immunology, but I think most importantly, I think seeing patients and understanding really what, their journey is and what they need and what's out there, what can we do better, what can we do to help them. I think that has been the most helpful thing about being in practice and taking that information with me to industry, because I think without that experience, kind of understanding a little bit of the patient journey, I'm not sure if I would have as much to contribute.
Yeah, I think having that knowledge base was probably key. And then finally, you had so many different options when you finished residency. I'm sure you thought about, academic medicine, and you ended up staying in an academic center for quite some time. Did you ever think about private practice? Did you ever think about a hospital system rather, outside of the university? Did you ever think about entrepreneurship? I mean, there's so many other angles that you probably considered. I'm just curious, what your journey was and your mental check down before you decided, hey, I'm going to work in the area that you're in now.
Yeah, honestly, I didn't think about any of those other things. I probably should have, but no, I would say,
Hey, it's
where
an
I
honest
trained,
answer, Chrissy. It's honest, right? It's
yeah,
easy to tell our story in hindsight, but sometimes we go with wherever it seems to be interesting, right? As we go along.
yeah. I mean, I really didn't have any real experience with private practices in general during my training, so I wasn't even sure kind of how you would get into that. How would you, get involved? Whereas kind of continuing the academic route, it just, kind of made sense with my goals, especially, with my focus in skin cancer and going to then the, Dana-Farber and Brigham. But it seemed like it was sort of just the natural next step. And that's why I think I got into this habit of sort of just doing things that made sense rather than sort of thinking about what actually makes sense for me and what do I actually want to do. And so I think that's when I started to shake things up this past year because, I think those things are important for people to think about. Like, where do you actually want to practice? And, is it something you maybe don't have experience with and you should, seek someone who's in that environment or a mentor or, a colleague or a friend and try to get an understanding of the landscapes, but also just knowing that, you can go down one path and then decide you just want to take a left turn and go down a different path, and that's okay.
Well, Chrissy, what I really appreciate about you is just talking about this honestly, because the truth is, yeah, we're supposed to think about all these things, but we kind of just take the journey that comes and stay open-minded. So on that note, speaking of sharing journeys and insights, I want to just kind of pull it back here and say, I want to thank you for your insights on TYK2 because I think it's becoming more and more of an area of discussion and we're now understanding its impact in the immunological space. Obviously, this is an enzyme that's a key player in our immune system, and I'm sure there's going to be more research that's coming up. So as we wrap up this episode, I just want all of us to keep in mind how our immune system's pretty darn complex, and we're continually learning more and more. So yes, we're understanding kinases like TYK2 and how it's important in immune-mediated diseases and probably beyond. And, stay tuned. And as Hadar always says, we want all of you to stay curious. So with that, I want to thank all of you for tuning in today. And if you are interested in learning more, check us out. Again, learnskin.com and look out for our annual Integrative Dermatology Symposium. And with that, Chrissy, I really want to thank you for your time today and thanks for joining us.
Oh, thank you so much. It was a pleasure.
And that's a wrap for today's episode, folks. And for you dermatologists out there, we've got an announcement for you.
Boy, do we. If you are a dermatologist and you're looking to take your practice to the next level and connect more closely with your patients, the Integrative Dermatology Certificate Program, also known as the IDCP, is the exact program for you.
The IDCP is an evidence-based training program that covers everything we wished we learned in residency, from the latest in conventional medicine, the science of nutrition and diet, functional medicine, the clinical evidence behind botanicals and herbs, all the way to the world of mind-body-based approaches, and so much more.
And the best part? You'll learn how to do this in a typical patient visit of a busy clinic, whether your practice is insurance or cash-based, or private, or even in an academic setting.
That's an excellent point. It's all about the mindset. Our graduates learn how to seamlessly weave these new concepts into practice and gain the confidence to answer the questions around nutrition, lifestyle, and product ingredients. The questions that usually make us a little uncomfortable.
That's right. And it's the only program of its kind in the world that combines multiple disciplines focused on dermatological evidence and care with such an amazing community of faculty, peers, and alumni, and who, by the way, continue to work together long after these programs end.
I guess it's true when we say Learn Skin is your partner in lifelong learning.
Absolutely. And space is limited. If you're considering joining the IDCP, visit learnskin.com to transform your life and practice forever.